Arthroscopic Bankart repair with Remplissage procedure. Our case is a 27-year female with 12-year history of recurrent shoulder dislocation. Physical examinations with positive apprehension, relocation, and surprise test of the right shoulder. Radiograph is unremarkable. MRI showing a Bankart defect with a large Hill-Sachs lesion, with glenoid bone loss computed at 15.8%. Fraying of the superior labrum. Bankart defect at 3 o'clock position spanning to the 5 o'clock position of the glenoid, and a large Hill-Sachs lesion. Debridement of the Bankart lesion and inspection for any bony defect was done. Repair of the Bankart lesion was done, ensuring adequate gutter and maintenance of stability of the glenohumeral joint. Inferior capsulodesis was done after Bankart repair, stabilizing the Hill-Sachs lesion. 2 years post-op examination, and our patient is back to sports without any recurrence of shoulder dislocation. Range of motion is full without pain and feeling of instability throughout the arcs of motion.